I'm Dr. Garth Manning, the Chief Executive Officer of WONCA, the World Organization of Family Doctors, and I'm here at the AFPI conference at the Habitat Centre in Delhi. Family medicine has been shown to be cost-effective and clinically effective. So in other words, for governments it's an attractive proposition because they get better health outcomes at lower cost. And it's also been shown that patients actually like family medicine. They like having a doctor in the community. They like having the continuity of being able to see the same doctor each time for their medical condition, and to be able to build up that relationship over time, and to be able to get 70 or 80 or even 90% of their medical problems sorted out in the community without having to travel to hospital. Well, WONCA is an organisation of organisations, but we have over 500,000 members in 135 member organisations. And our key roles are to bring the family doctors of the world together, in other words, to improve networking so that we can learn from each other. It's to improve standards of clinical care and research and training. And it's also, we represent family medicine at the World Health Organization. We're the voice of family doctors with WHO. Globally, we do our best to support family medicine education and training in all the countries of the world, particularly those that haven't got formal education and training in family medicine. This is part of the networking, of course, that that we help doctors to learn from each other. And we have developed various programs. We can accredit family training programs in countries of the world. And we provide a number of resources to the family doctor organizations to help them as they develop their own education and training and curricula and so on. India is a conundrum. Many years ago, India had family medicine, and it sort of lost that about 50 or 60 years ago as it went along the specialization and super specialization route, and so family medicine became an unattractive career option. But there have been a few key dedicated people who have really tried to put family medicine back on the map, particularly Raman Kumar and the group of doctors in AFPI. And I think the situation is shifting. I think there's a momentum now to see family medicine developing more in India. I think there's a long way to go, but I think there is now a recognition that not having family medicine has been a mistake, and that relying too much on specialization and super specialization means a lot of out-of-pocket expenses. So I think the poorest members of society simply end up not being able to afford even the basic standards of healthcare. So I think there's a recognition that family medicine, provided as part of the government public health service, is an essential, really, to be able to provide universal health coverage to the entire population. Globally, I think things are improving as well. I think there is a greater recognition with governments that family medicine has a lot to offer. I think because it's cost effective, clearly governments all over the world are very aware of budget problems, and so when they find that family medicine is a more cost effective option, and it also offers better clinical care, better health outcomes, lower costs of drugs, better patient satisfaction, then I think they start to look at it more critically and start to realize that it is a better option. So I think globally, there's still a lot of work to do, but there's a greater and greater interest in many countries of the world. As people get older, they get more and more, they have more and more medical conditions, comorbidities. And so, care that's disjointed, going to see one specialist for one problem and another specialist for another and another specialist, ending up on a whole lot of different drugs and tablets and treatments and everything else. I think the family doctor takes a much broader view, and is able to coordinate and offer a much more comprehensive view of the healthcare, and acts as the advocate for the patient to make sure that the patient is actually getting the best treatment. It's all too easy for one doctor to prescribe something that contraindicates or counteracts something that another doctor is doing, or it's all too easy for a patient to end up on 20 or more tablets a day. And the family doctor, I think, can coordinate care much more effectively. And I think because we build up a relationship with our patients over time, I think the patient believes in us and trusts us to a very great extent, and that's actually quite humbling. The problem of patients aren't aware of family medicine, and they aren't aware of the services I think that it can offer. They aren't aware of the continuity and the coordination and how important those things are. They simply look and see, who's the best physician or who's the best surgeon or who's the best for this or that, without actually appreciating, I think, that overall that is not necessarily in their best interests. Hospitals are dangerous places after all. Hospital-acquired infection is very common, and the more specialists you see, the more investigations you will be exposed to, and every investigation has a morbidity and a mortality. You'll be put on more and more treatments, and every treatment has a morbidity and a mortality. So, whilst the hospital specialists are doing their best, in total, it's often actually not the best for the patient. But we've got to make the patients more aware of that. So I think there's got to be a strong public relations exercise, really, to teach patients more about family medicine, the role of a properly trained family doctor, and the services that can offer, and how ultimately that leads to a much better standard of care for them. There has to be political will. Without explicit political support, nothing's ever going to change. But I think India has a great opportunity to increase the number of training seats for family medicine, but that's got to be combined with improving the career prospects and improving the pay and conditions for family doctors to make it a more attractive career option. We've got to expose medical students much more to family medicine so that they understand that this is a potentially exciting and viable career option. So there are a whole lot of things that I think need to go together to encourage people to go into family medicine. But I think India is starting to recognise that much more and starting to take steps necessary. Certainly, hearing the talk today from the National Board of Examiners gentlemen, I think they're very aware of this and are taking active steps to try and improve the situation, which is very encouraging.